Hi, Miss Nolan. I wanted to explain a few things before we jump into the video. I'm going to have my person who's going to play my patient also play my cameraman, since I only have one person here in quarantine with me. I'm doing that so you can get a nice close-up of when I do certain parts of the video. If you don't like that, let me know and I'll refilm it for you. But I hope you like it and I hope you're well. Bye! Alright, so this morning we find ourselves in the medication room and we've got orders here from the doctor to give Mr. Hayes medication, his morning medication. We've got orders for enoxaparin sodium, omeprazole, and hydrocodone bitartrate acetaminophen, and we're going to pull those from the Pyxis now. So the first medication, we have enoxaparin sodium at 40 milligrams given subcutaneously. So we're going to pull that here. We have enoxaparin sodium. We have 80 milligrams per milliliter, so we'll make sure we give him half a milliliter. Our next medication is omeprazole, and we have 40 milligrams by mouth. So we'll pull omeprazole. We have a 40 milligram tablet that we'll give him by mouth, so we only need one tablet. And then our last medication is hydrocodone bitartrate at 10 over 325 milligrams by mouth. So we'll go ahead and pull that. We've got hydrocodone bitartrate acetaminophen 10 over 325 per tab, so we'll only give him one tab of this. In addition to our medication, we'll also pull some alcohol prep pads, a syringe, and the last medication. All right, let's go to Mr. Hayes' room. Knock, knock. Good morning.
Good morning.
My name is Kayla. I'll be your student nurse this morning. Can I get your name and date of birth, please?
Marvin Hayes, 3/20/77.
All right, Mr. Hayes, and do you have any allergies?
I do not.
Okay, Mr. Hayes, let me check all of that here against your wristband. Can I get your wristband? All right, that looks good. All right, we're here this morning for morning medication. How are you doing this morning?
I'm in a little bit of pain.
You're in a little bit of pain? Okay, I've got a medication here for pain. How would you, on a scale of 1 to 10, how would you rate your pain, with 10 being the worst?
About a 5.
About a 5. Okay, so this medication should help with that. All right, we've got 3 different medications here for you this morning. We're going to do our next check. Our first medication is going to be omeprazole. And we're going to check that again against our medication administration record. We've got medication omeprazole at 40 milligrams ordered, and we have omeprazole 40 milligrams per tab, and we have one tab. Now we're going to do our 6 rights. We have the correct patient. We have Mr. Hayes, who's been identified with 2 identifiers, his verbal confirmation as well as his wristband. We have the right drug. We have omeprazole ordered, and we have omeprazole here. We have 40 milligrams ordered, and we have 40 milligrams here, so we have the right dose. The route is ordered is by mouth, and we have one tab that we'll give by mouth. We also have the correct time. Medications were ordered at 9 a.m., and it is currently 9 a.m. Now, before I give this medication, we're going to make sure I educate the patient about it, and I'm also going to document everything once I'm finished. Now, Mr. Hayes, would you like to take all of your medication at once, or would you like to take it one at a time?
One at a time.
Okay. Your first medication is omeprazole, and this is to help with any acidity in your stomach. And please let me know if you have any kind of reaction with it. All right, so we have omeprazole. We're going to check that once again. We're going to place it here in our cup. Now, would you like some water with this?
Yes, please. Thank you.
All right. Our second medication ordered for Mr. Hayes is hydrocodone bitartrate acetaminophen, and this is for pain, and he did indicate that he had pain, so even though it's a PRN medication, we'll go ahead and give it. We have hydrocodone bitartrate here with acetaminophen at 325 milligrams per tab, and that is what we have ordered here. So we have checked to make sure our medication is correct. We're going to go through our 6 rights. Again, we have the right patient, Mr. Hayes. We have the right drug, hydrocodone bitartrate acetaminophen. We have the right dose, which is 10 over 325 milligrams per tab, and that is what is ordered, 10 over 325 milligrams per tab. We have the right route. We have a tablet, which can be taken orally, and that is the route that is ordered. Again, I will educate the patient, and at the end of all this, I will document what I've done. All right, Mr. Hayes, your next medication is hydrocodone bitartrate, acetaminophen, and this is to help with your pain. Now, I need you to let me know if you have any trouble breathing after I give you this, if you have any constipation, and if your pain doesn't go away in the next 30 minutes to half an hour.
Okay.
Thank you. All right, our last medication that we're going to give Mr. Hayes this morning is enoxaparin. We're going to go through all of our rights and our checks, and then I'll show you how I give an injection. So we have enoxaparin here, enoxaparin sodium. We have 80 milligrams per 1 milliliter, and we're going to give, and that is, we have 40 milligrams ordered. So we'll give him half a milliliter. We have the right patient. We have the right drug, enoxaparin sodium. We have the right dose. We will give him half a milliliter of medication. We will have the right route, which will be subcutaneous. And again, it is the right time. It is 9 a.m. and meds are ordered to start at 9 a.m. Again, I'll educate the patient and I'll document all of this once I'm done. Now, Mr. Hayes, when I give you this medication, I need you to report any signs of bleeding, such as bruising or any bleeding from anywhere. Can you do that?
I can.
Okay. All right. Now I'm going to have you be my cameraman, so I can show the camera exactly how I do this. All right. So we have an order here for subcutaneous enoxaparin, and we've got an order for 40 milligrams. Our medication is 80 milligrams per milliliter, so we're going to draw up half a milliliter. I'm going to hand hygiene. Set those right here. Okay, the first thing I'm going to do is I'm going to clean the very top of my vial, and I am going to carefully open my syringe. And I'm going to draw up half a milliliter of air, and then I'm going to inject that into the vial. I'll bring my abdomen back up here in a minute. I'm going to inject that into the vial, and then I'm going to withdraw half a milliliter of medication. Now I'm going to make sure I have no air bubbles and everything looks good. And then I'm going to recap using the one-handed scoop method. Okay. Now, this is a medication that I'll be given subcutaneously. This can be given in many areas. This can be given at the back of the arms. This can be given in the abdominal area, and it can also be given in the tops of the thighs. We're going to go ahead and give this in the abdominal area on the right side. We're going to make sure that we avoid the umbilicus by 2 inches at least, and we're going to make sure we avoid any scar tissue as well as any tattoos. So I'm going to hand hygiene, and I'm going to don my gloves here because we are working with our patient. And I can go in at a 45 or 90 degree angle, but Mr. Hayes has a good amount of tissue here in his umbilicus, so we'll go in at a 90 degree angle. And first I'm going to clean the area, and I'm going to lay my alcohol prep pad pointing down to where I want to inject Mr. Hayes. Okay, Mr. Hayes. Once again, this is the right drug, enoxaparin sodium. We've got the right route. We're going to give this subcutaneously, and we've got the right dose, which is important. We've got half a milliliter, which is will give you 40 milligrams of medication. All right, Mr. Hayes, you're going to feel a little bit of a pinch. I'm going to pinch up the skin a little bit. Ready? 1, 2, 3. Now at this point I would normally engage my safety, but I do want to keep my needle for practice, so I'm going to use the one-handed scoop method again. I'm going to put the cap back on, and I will discard this in my sharps container. And I'll put some pressure on that. And that looks good. Now I'm going to take my gloves off, and I'm going to hand hygiene once again. And Mr. Hayes, you can now hop back in bed. All right, Mr. Hayes, how are you doing?
I'm doing better.
You're doing better?
Mhm.
How's your pain doing?
It's getting better.
It's
It's still there.
Okay. Is there anything I could do, maybe a back massage to help?
That would be nice.
Okay, can I have you sit forward a little bit? All right. How are you doing today?
I'm doing good.
You're doing good? Are your kids coming to visit you today?
They are.
Good. I'm sure they'll be very happy to see you.
They're wonderful kids.
Oh, excellent. I'm very glad to hear that. How about your wife? Is she coming to visit you today?
Yeah, she'll be here too.
Okay, good. All right, Mr. Hayes, how are you doing now?
Doing great.
Good,
Thank
good. I'm glad. All right, you can sit back in the bed. Are you in a comfortable position?
you. I am.
Okay, good. And your pain's doing better now, you
Mhm.
said? Okay, good. Now, do you need to go to the bathroom while I'm
I
here?
don't.
Okay. Well, let me know if you do, and I can come help you if you need that. I've got all your pumps and your tubing. It's unkinked. Everything looks good with your tubing. It's not tangled or anything. I see you have your phone there. Do you need any other possessions nearby?
I don't.
All right. And is there anything else I can help you with today?
No, thank you.
Thank you so much for your time, Mr. Hayes. I appreciate it. Hand hygiene. And we're done.